Welcome to today's Explainer. We're diving into something really eye-opening today, the profound intersection of housing instability and chronic disease. We're going to unpack a comprehensive review conducted by the Valiant Foundation, and I promise you it completely reframes how we think about chronic illness on the streets. Let's get right into it.
Think about this for a second. What actually happens when someone with type 1 diabetes loses stable housing? Diabetes is already incredibly tough to manage under the best circumstances, right? But when you're facing homelessness, that daily grind just for basic survival completely derails life-saving medical care.
Section 1. What is type 1 diabetes? Let's get into the basics.
So, type 1 diabetes, or T1D, is a chronic autoimmune disease where the body literally just stops producing insulin, and here's the absolute kicker. Without an uninterrupted supply of exogenous insulin, meaning insulin you have to inject, blood sugar spikes to lethal levels. It's not optional. It is an absolute requirement to survive.
To manage T1D safely, you have to follow some seriously strict daily protocols. You absolutely need reliable insulin access. You need a fridge to keep that insulin between 36 and 86 degrees Fahrenheit. If it gets too hot or if it freezes, it's ruined in just a matter of hours. Add in the need for regular meals, constant glucose monitoring, and clinical checkups. Honestly, even in a stable, housed environment, that is a massive burden. Out on the streets, it becomes practically impossible.
Section 2. Managing T1D unhoused without safe environments.
There is just a night and day difference between standard T1D care and the brutal reality of homelessness. In a clinic or a home, you've got safe storage, regular food, and support. But unsheltered folks, they're facing massive roadblocks. We're talking no refrigeration, frequently stolen medical supplies, and totally irregular meals. Just imagine trying to calculate a precise insulin dose when you literally have no idea when or even if you'll eat next.
And that brings us to what researchers call the survival trade-off. When you're unhoused, you're forced to put immediate survival first. Finding food, finding a safe place to sleep, just staying warm. All of that has to take priority over long-term disease management. You just can't expect someone to perfectly balance their insulin levels when they are entirely focused on surviving the night.
Section 3. Severe health impacts and the physical tolls. 650, that is 650 milligrams per deciliter. It's a frankly terrifying blood glucose level documented in a specific case study of a 41-year-old unsheltered man. To put that into perspective, a normal blood sugar level is typically under 140. So 650, that is a massive metabolic breakdown, directly caused by prolonged difficulty getting insulin while living on the streets.
And the results of levels spiking like that, they are catastrophic. Because he couldn't access care, that patient developed diabetic ketoacidosis, or DKA, which is a life-threatening emergency. He also suffered systemic infections that ultimately led to multiple toes being amputated. And when you look at the broader unhoused population, the research reflects this exact same grim reality: way higher hospitalization rates, more DKA, and disproportionately high rates of amputations compared to people with housing.
The absolutely crucial takeaway here is that unstable housing itself is a major independent risk factor for these terrible clinical outcomes. The research proves that simply lacking a home actively drives worse health. One study even found that homeless minors with T1D had substantially higher hospitalization rates than their lower-income housed peers. So the lack of a home isn't just a complication, it's the primary driver of the crisis.
Section 4. Effective interventions and evidence-based solutions.
Now, the Valiant Foundation didn't just guess at what might work. They did a rigorous, systematic review, using proven methodologies to filter through dozens of records and identify the core studies that truly address public health models for unhoused individuals. This means we aren't just talking about theories, we're looking at real, validated evidence.
So what did that deep dive actually find? Well, it turns out that supportive housing is the absolute foundational intervention. A housing-first approach tackles the root cause of this healthcare fragmentation head-on, because it instantly provides exactly what the patient needs most: a fridge for their insulin, a safe place to store medication, and a stable environment to build routine. Once someone is housed, preventable complications absolutely plummet. But while we work on getting people housed, we still need immediate medical interventions right now. That's where low-barrier healthcare models come in. We're talking about street medicine, outreach clinics, shelter-based screenings, and mobile health programs. Instead of expecting highly vulnerable people to somehow navigate a super rigid medical system, these models actively bring the healthcare directly to them. They facilitate insulin access right on the spot and integrate with social services.
Section 5. A public health mandate. Let's look at systemic solutions.
Ultimately, this isn't a personal failure. It is a massive systemic failure that is deeply tied to housing instability, a lack of healthcare access, and poverty. There's a quote from the research that perfectly nails it. Homelessness transforms T1D into an acute crisis rather than a chronic routine. We really have to acknowledge Principal Investigator Sarah Jean Valiant and the whole Valiant Foundation research team here. Their work proves that without environmental stability, managing a chronic disease is fundamentally impossible.
I want to leave you with a pretty provocative question to chew on. How can our healthcare systems adapt to treat those who don't have a home to heal in? If the very foundation of our medical care assumes that a patient has a working refrigerator and a safe bed, how do we rebuild that system for the people who don't? Thank you so much for joining me for this explainer. Keep asking those big questions, keep learning, and I'll catch you in the next one.